And then I need to do the pop out chat for today's live. Yep, pop out chat. Pop out. Live chat. Copy. Hey, Tasha, how's it going? Oh man, you must have been stalking my page to find me going live. Let's see, what am I doing? I'm doing pop-out chat. That's right, and I'm doing properties. Paste. Okay, there we go. How's your Sunday going? You got the notification? That's awesome. Yay. I'm so glad. I was trying to prep for turning the 2024 book into a 2025 book, and I ran across, let's see, we got 5 on now. You have to go through the AMA website, and you got to go download all of their technical corrections and things, and then their meeting minutes when they meet and talk about they have these minute meeting notes that you can go through and you can read, you know, where they adjourn and they list all the people of who were here and why we're here and what we're doing, and then they talk about what they did during their meeting, and then they got to submit all their paperwork for changing some of the codes, and it just goes on forever, and you got to look up these related documents that go along with it. They're letters and preliminary reports and stuff like that. But you eventually get down to what they're doing. They are like updating value codes, revenue codes for certain CPT codes and stuff like that. And then they'll also give you a list of some CPT codes and when they'll be going into effect and when they will hit our books, and then some that are rejected or postponed or withdrawn. You eventually get into some of that paperwork. So we've got some new radiology codes, it looks like here, that are going to come out. We got some new integumentary codes that are going to come out. Some new vaccines, but these are just the influenza ones. There's a new genetic counseling service that's pretty cool. You know, we have counseling service codes for obesity and to stop smoking, but not one for genetics, so that's pretty cool. They have a pediatric passive immunization administration code that I don't think is in the book yet, that went into effect October 23rd, but it didn't even get released till October of 2023. So I don't think it made it into the 2024 book. So it'll probably end up being in the 2025 book. We got some new cognitive therapy codes. That they're going to be revising some of the CPT code descriptor, and then some category 3 codes that those won't be on the exam, so we don't have to worry about those. But that is just one meeting. They've had 4 more meetings since then. Another influenza virus one. This one is a new category 3 code. They accepted a new femur lengthening code for femur tibia. So there's 2 new muscular skeletal codes, but those won't go into effect until 2025. So we don't have to worry about those, well, until 2026, I mean. So we won't have to worry about that for 2025. But that's something new that's going to come down the pipe. So you have to be careful. Just look for the ones that are only going to be effective in 2025. There's a new neurofilament light chain. I wonder if this has got to do with any neuro implants that's coming down the pipeline with Elon Musk, but they're going to have a 8,000 code for that. Bacterial vaginitis test, a new multi-step assay is coming out in 2025. A pneumonia amplified test, an optical genome mapping, 2025, an HPV, a new strep antibody test, 2025. These are hereditary cancer disorders that they accepted. 3 of them are going to get revisioned, and then 3 of them are going to get deleted. That's 2026. We don't have to worry about that. There is a 2025 ablation of an arterial fibrillation. It may be just a revise instead of a new code because they've got the revise thing on there. So, but the cool thing was when I was going through some of their meetings, I noticed that a lot of people, when they get my notes, you know, I'm not perfect. There sometimes are errors in my notes, and people get real offended by it, and I don't blame them because, you know, they're paying for my notes, of course, and they feel like they're should get something that's perfect. And of course, I'm not perfect. I'm just a human. But I don't know if a lot of people realize that a lot of our material is full of errors. Everything we've ever looked at or been educated on, every manual or book or anything, all has errors in it, including the CPT book. The book that we've got does have some errors in it, and I thought that was really cool. Let me get, where is my camera? There's a video capture, good. And then I want to do that one. Will you come on? You may not come on. Will you come on? Let's see. That one won't. That one won't. But maybe I can't do it at the same time. I wish I could do split screen. Let's see. We've got, if I turn that off, then will the camera come on? Yeah, of course. So if we turn to our 2024 CPT book and we go to our E&M codes, they've got a pretty big error in there. I was curious about it too when I saw it, but I didn't say nothing. But it's in codes that we don't use a whole lot in the exam. There are some that we do use in the exam. Let's see, we're going to go to telephone. Where are we at? We're going to go to our telephone phone calls with our patients, right? Online, telephone ones, yeah. And if you're in the 2024 CPT book, we're on page 40. And they've got an error in the book that we need to get rid of. And what they did was this whole sentence about using that prolonged service code is not right. Everything from the treating physician right there is all an error. You can draw one line through it if you feel like you want to get rid of this sentence, but it's a incorrect guideline. You draw all the way through all of this. We can't use that. Exceeds 30 minutes, qualifying physician, all of that. Exceeds 30 minutes. Beyond the typical time of an E&M. Yep, all of that goes. All the way down to there is all a big error that they have. And I think we need to get rid of the last sentence too. If exceeds 30 minutes of the non-face-to-face, if the interpersonal, yep, we're going to get rid of this sentence too. All of this goes too. All of that is a big error. And in the 2025 book, they'll have this fixed, but all of this is an error in the book. What they're going to rewrite and put here is a sentence that's going to say, if the telephone, internet, electronic health care record referral service and an E&M service are performed on the same day by the treating physician, the total time is used to select the E&M service. The time spent providing the referral is added to the time on the day of the encounter performed on the E&M service. If the MDM is used to select the level of E&M, the work of the performing and referring service is considered part of the MDM. Do not report 99452 separately on the same day as an E&M service is reported. That's what they're going to replace this sentence with. So if a telephone, electronic referral, and an E&M service. What are we calling these? We're under the header of, I'll just put electronic. So they're saying if an electronic visit or a telephone referral service same day as in-office E&M, just add the time. And then they don't want two separate MDMs. They don't want a separate telephone call billed, and then they do not want a separate E&M. Just add that time to the original E&M visit, because some patients will get seen and then they'll call back in the middle of the day and say, yeah, you know, I do want that referral. They'll speak to the doctor for 10 to 15 minutes on the phone after their visit that they had that day, and they'll come up with a plan about doing a referral. Well, this is just telling you that the doctor is not supposed to add a separate code for a Zoom or telephone meeting, that they're supposed to just add that time to the original E&M visit that they had earlier in that day with the patient. Is all that deleting and then making a new one. And so they said to add do not report 99452 separately. Okay. Nine nine four 5-2. Do not report 99452 separately on same date as E&M. Yep. Yep. And they got anything else worth a darn here? It's just kind of interesting how there's even errors on our CPT book. They have, and they publish them and put them out, and it's our job as coders to remember to go to the AMA website monthly, sign up for their emails, and every time they revise or send out a new update, then let us know. The most recent entries of technical whatever, they corrected 11107 to indicate it's a child code to 1106. Let's see, did they fix that in this book or not? And then we're supposed to go and update these books and fix their errors after they publish them. Because you know, you can't get everything correct. I know, Lord, I've tried. It's hard. 11107. And it's hard when you're creating it to know that, to see the error. That one is noted as a child code, so that must be from a previous one. They revised the parenthetical, removing the term esophagus, 991111, 91111. What are all those nines and a bunch of ones? They had to remove the word. But anyway, does that make sense? I've gone to the AMA website. I've scoured it for any corrections of their CPT book. This one right here. Let me turn this off and turn back on that one. Oh, yeah. Turn back on this one. I'm at the 91111, and I'm making sure we have to remove the term of esophagus in here. Nope, it's still there. So we need to remove that term because that's an error in it for some reason. Revise the parenthetical note. Maybe there's a parenthetical note that had esophagus in it. In the gastrology. Maybe this is the esophagus. It said parenthetical, not in the CPT code descriptor. Sorry. It says in the parenthetical, revise the note following the 111 by removing the term esophagus in the gastroenterology subsection. Ugh. Yeah, it'd be nice. Tell me what page number and what code to fix. That would be nice. The way they write these things is just a nightmare too. And then we're supposed to go through them and fix it. But anyway, they've got another one. Something around, I wonder where this is at. Category 1, E&M Management, Transitional Care Management Services. We're supposed to find a coding tip, and then under it, it's supposed to have the required contact patient and caregiver. There's this error about 2 business days we're supposed to remove. But trying to find this stuff, Lord. All right, Category 1, E&M Services, Transitional Care Services. Where is that? Transitional Care Services. Do we even have Transitional Care Services anymore? Case Management, Chronic Care Management, Complex, Principal Care Management, Psychological, Behavioral, Transitional Care Management. There you go. We're on page 59. And then we're looking for a coding tip. Up at the top, maybe? If, no, that's not it. The required contact with the patient or caregiver. The required contact is how it starts out. Oh, second page. Page 60. So, if we look in our CPT book, and we're in the AMA 2024 CPT book, we're under this coding tip right here. They have another error on this one. The one that I underlined, actually, I had questioned. I was like, what in the heck kind of guideline is that? I underlined it. That's the error. Within 2 business days, discharge on a Monday through a Friday, except on a holiday. I was like, how in the world would you remember that? Yeah, that's an error. We'll get rid of that one. Yeah, we had that. And it is a child code on subsection. Yeah, we understood that one. That one's already fixed. Code 272. Two 27279. 27279. Yes, you know you can't use whiteout. Don't even ask. You can't use it. You know that, so don't ask. I have it because I want to. Alright, where are we at? Fixing. This right here, this trans fixing, needs to say simply trans fixation. That one wasn't major. They just don't like the word transfixing. It's not the proper term for it, so they're just changing that word to transfixion. That wasn't a big thing. They've got a parenthetical with the wrong code on it for 645. 645. 64595. Six, 4, 5, 9, 5. Right here. No. Not that one, maybe. Let's see. For revision or removal of a percutaneous electrode array, the integrated neurostimulator is not that code. They're supposed to use 6, 4, 5, 9, 8. That's a pretty big error right there, because, you know, if you are relying on those parentheticals to be correct, that's a huge difference. It's not just one number away. So, or I guess it is one number away, but 97 to 98, yeah. Anyway, it's a bigger deal one right there. Lab and path. Oh yeah, they had this one so wrong. I was wondering. All right, lab and path. 80503. 805. So we're just fixing errors that are in the 2024 CPT book. These errors are released through AMA in a nightmare barrage of emails that no one ever reads. So our 80503 is not supposed to be low. It's supposed to be straightforward. I'm not using the right pen. I need to get out my right pen. It still has a limited data and it still has a low risk, but the diagnosis will be straightforward. And then we need to probably go over here to the actual, that's on page 626 if you're in the 2024. The 2023 book, I don't know if that has it. And then we got to fix it in another area if it needs it on page 628. Let's check it here. What do we got? See, it's straightforward here. And it was low in the table. It was just the table that was wrong. So we're okay there. All right. We got a new code we could add to that one, but that's not gonna, that code is not gonna be on the exam. Let's see. This code is definitely on the exam. Let's see. Let me see if I can find it. I don't know. I don't have a code number yet because this is a guideline. Let me find the guideline. The guideline's going to be near the vaccines. The vaccines and administration. Yep. Where are we at? report. For vaccines and toxoids for immune globulins. That's over here. For immune globulins. I think we got something we got to fix here. 72, 74, 75. It's added here. Where is it missing? Oh, it's a parenthetical. I think it's a parenthetical. Yeah. Right. Yeah. It's on page 744. Down here at the bottom. Here at the bottom, they don't have the 7.5, which if you look over here on this page, they do have the 7.5 listed on the other page over here, sorry. So we're going to add right here a 9, 6, 3, 7, 5 so that it matches what's on the opposite page, which is right there for the immunoglobulins. Right there, it's got the 7.5 in it. So just when they rewrote it in a parenthetical, they left off one of the 7.5s. So stuff like this, it's, you know, 7% error rate is about the average where you want to say, you need to go send this back to editing. Anything over 7% error rate, and you want to have a better editor working with you, of course. So as long as your error rate in your published work is less than 7%, then you're good. My error rate is around a 1%, but it's still going to be there. You're still going to have errors. All right, where are we at? What is this? Okay, I did the esophagus index. All right, in our CPT book 2024, in our alphabetical index back here, we've got some errors in it under hospital services. Where are we at? Do I look under the word hospital? Oh, I wish I knew or had a screenshot of what they were talking about, where the error was. They're not that handy dandy. They just kind of tell you, and then you got to figure out where it's at in the book. A, B, C, D, E, H, H, O, H, O, S. Hospital services. Yeah, there it is. Okay. They do have it right there. That is an error. I did not notice that because we use our book, not like real medical coders, because we don't use these anymore, but we would have noticed this. If you look at hospital services, where it says admit and discharge same day, they only have one code listed. You know we have more than one code listed, right? So it needs to have a 9, 9, 2, 3, 4 through 99236 listed right there under hospital services. Yep. Is a typo or missing element. Isn't that cool? I mean, I don't know. At least I'm not the only one that has errors. Sorry, Veranda. I'm just now looking up at messages. I forgot I have messages I need to look at. You got the notification. Yay, Jessica. I'm so glad. Hey, Twinkle. How's it going? Multi-step essay. I know, right? Some steps, some strep screens or throat cultures are single step, where you swab the throat and put a little solution in them. Some of them are multi-steps, where you put the swab in a solution, you let it sit, and then you got to add a primer to it, and then you got to swirl it. I don't know. Some of them are multi-steps, so that's what they were talking about with the multi-step prep. I have an AMA 2024 book. Awesome. I signed up to take my first attempt a CPB exam for tomorrow. I have no expectations going in, just want to see how it goes. Tell me all about it, Taylor. Let me know everything you can remember. I would love to get an email from you to tell me what you thought. Best of luck. I hope you knock it out of the park and just get you a 70 and walk away. But if you don't, it's a great learning experience. That's exactly what I did. I scheduled my first one. I was like, okay, what do I want to see? All standard errors is 70% for all our work. I don't know about if you're talking about medical coding. I'm talking about published works as far as a publisher is concerned. Like the people that wrote Alice in the Wonderland. There's a couple of sentences that are repeated back to back, and it's not part of the story. It's just a typo error, you know, things like that. If you have a published book out, anything less than a 7% error rate is good, is all I'm saying. Our medical coding and what your job expected error rate is something totally different. So, hey Fagan, how's it going? So I was just showing you guys how you can look up the from the AMA and see what types of errors are in your CPT book, and as soon as they publish one, of course somebody's going to find an error, and then you are to go through the book, find these errors and correct them. And I was wanting to turn a 2024 book into a 2025, and then I ran across, while I was doing my research for that, the errors, and I've never talked to you guys about the errors and shown them to you, so I thought I'd start off with the errors. If we look at preventative medicine in this index, since we're back here, we can go to the P's, A, B, C, D, E, F, preventative, P, R, E, preventative, medicine, comprehensive, established patient. They have an error of 99382. Yeah, no. So let me get back to the camera. So I'm fixing that error that's in the middle of the page. Let me get back to the video. Is that the right video? Nope. This is the right video. So I'm in the back. I'm under the word preventative medicine. I'm at comprehensive and established. We're not supposed to be at 99382. We're supposed to be at 99391 through the 97. Code 950. But it makes me feel better that, you know, at least I'm not the only one that makes errors. 950. It's a big undertaking to write something, have it be 100% correct. It's hard. Harder than you think. All right. Allergy testing. No, y'all don't have an error in the allergy testing, do you? 95024. It's not supposed to say what? Test with allergenic extracts. Good. Then before it, it's not supposed to say I cut allergy test drug bug IQ. It doesn't. That one must have already been fixed. I don't see the error that they're talking about in this one, or at least in my publication. If you got a different publication and you're 95024, if it says I cut, all one word, ICUT, allergy, test, drug, / bug IQ, get rid of that. They replaced it with test with allergenic extracts. Good. 613. 61315. 61315. 615 Short descriptor, medium descriptor, and then medium descriptor file. Wow. This one's okay for the CPT book. Also. All right. They'll send you out these correction documents. This one's about 64597. It's how you code this code. They took out the words neurostimulator for some reason. And this is just an electrode array, so it's not a neurostimulator, I guess. They have a correction on one of their tables where if you're doing right ventricle and we're using a category 3 code, it's supposed to go with a 33274 code. But I don't know where this chart is, and it'll take me too long to figure it out. It's probably back there in the category 3 codes. But it's interesting. You can find these on the AMA website under the summary of the panel actions, and then you download each one of their actions right here, and then it gives you their notes of what the panel did and what they corrected, what they rejected, what they postponed, all that kind of stuff. And then you just kind of piece through it and fix it. Boy, I'd hate to have to fix the CPT book off of this. and be 100% confident. They don't even have their spacing correct on this stuff. So, look, we got some modifier 95 reporting instruction changes. That's going to go into effect January of 2025. They're going to remove the star for the telemedicine symbol next to those because we're no longer in our COVID period and you can't bill for stuff for telemedicine anymore like you used to. So they're going to get rid of that star. Pretty cool. You can see what's going to come up, what's next. Got a new flu one. This was crazy. Looking at this, yeah, we'll skip it. It's just a lot. But what I did like about this little document and that I thought was worth saving, and I'll go back to, is look, it tells you what your global period is for some of these codes. So, and I know that's a hard one, like this one, the 46275, it's got a 90-day. We're expected to know which ones have 90-day, which ones have 10-day, which ones have 0 days, and we don't know because we don't have access to this data in our manuals. But this document that I got from them went through a bunch of them and gave me the global periods of a bunch of codes. So I thought that was cool. Downloaded that from their site. That's where the rev codes changed, where they're given more money for certain codes. One of those meetings. Same thing, more global period. This is more revised codes, new codes that will be coming out in 2025. Those were all changes in 2024. That's a new influenza. We've already seen that one. There are some new, yep, I already talked about them. The new cancer genetics test, good. Those are category 3 codes. Those won't be on the exam. 2026 is going to have hearing devices. Going to have a bunch of new codes for that, but that's not until 2026. They have a new vaccine for 2025 there. But really there wasn't a lot. A lot of these are category 3 codes, and we don't update those because those are rarely on the exam. There's just not a lot for 2025. It either got changed in 2024, or if it's a 2025 update, it's just a vaccine or a category 3 code. This one's going to be new for 2025. It's a lab. It's a new protein one. We don't have the full code number yet. We've got an 8-2 and then 2 placeholders and an O and a 1. We've got another protein right there and a total protein. So 4 protein codes in the lab and path. Kidney transplant, new code for a lab. In 2026, it looks like we're going to have a whole bunch of new codes in the coronary therapeutic services. It just looks like the 2026 book is going to have more than we can manage for changing and updating new codes to me. But that's a whole lot of coronary therapeutic services to write in. They also have all those hearing devices, the adapting screenings. Those are all 2026. These 2 vaccines are 2025, but they won't be on the exam. Anyway, it was interesting. But we can go do something else, something fun. I haven't been to Pocket Prep lately. How have you guys been doing with Pocket Prep? Y'all been doing your question of the day and doing your time quizzes or your quick 10, or are you building your own exams? I haven't been in here in like 3 months. Come on. What kind of questions would y'all like to do? We could build an exam with just E&M questions, or we could do all cases or lab and path. Whatever in the world y'all'd like to do, we could do. Using that website, we could write in all the global days in our books near the codes. You could, isn't that cool? I was worried about 7% errors. Yeah, don't worry. What it says number of tests, does it mean sticks per exam? 95015. Let me see. 95018 question. When it says number of tests, does it mean sticks per exam? No. It could be any combination of any kind of scratches, pokes, or pricks. We're supposed to times it by how many things we're testing them for. Like if you're testing them for a penicillin allergy, are you doing just one penicillin allergy or 3 different forms of penicillin? If you're doing plants, scratch test, are you doing for pine, maple, whatever? How many things are you testing them for? So if you're testing them for 25 different variations of trees, then you put this number times 25. So that's how you do. Sorry, somebody was asking me about, and I didn't even have the video on, the this one right here, the 95018. They were asking about the code descriptor because it says specified number of tests, and it does say any combination, so it's kind of confusing. But right here you would times it not by how many pokes, but how many things are you testing them for an allergy for. How many different pine trees, or how many different milk products, or whatever. Yeah. So that's how you do that one. But on our Pocket Prep, what do we want to do? What kind of practice exam questions do we want to do? Can we use the AMA CPT book as well, correct? Yes, it's the only CPT book there is, Mel, is the AMA CPT book, as far as I know. That's the only CPT book. The ICD-10 and HIPICS can be any version of it, but I highly recommend you use an AAPC version if by chance you happen to be taking an AAPC certification. I don't recommend you buy them from AAPC because they charge you $20 per book to ship it, but I do recommend their books if you're doing theirs. Compliance and regulatory. Ooh. All right. Got to vote for compliance and regulatory. Oops, sorry. I need to go back because I forgot to pick. How many questions? Compliance and regulatory. 29 questions. What is the difference between an insurance plan, co-pay, and co-insurance? Co-pay is a set amount due to time, due to what the patient must pay at the time of service. Set amount the insurance pays, or half of the service. Just type in chat what you think the answer is. While a co-insurance is to pay anything. That's funny. Yeah. You can hit on Pocket Prep, show explanation, and it's supposed to tell us where the answer is. And that answer is at healthcare.gov copayment. So it's something that you got to go look up on a website somewhere else. And they do give you some rationale there to go along with it. 22, 21, 23, or 11. Where would we do a transdoppler cardiac monitoring be done? So if we go to our POS page, which is in the front of your AMA CPT book, it's called the Place of Service page. You're going to look through. Number 11 is an office. 21 is inpatient hospital. 22 is on campus outpatient hospital. And 23 is emergency room hospital. Where are we going to be doing that? If, put that over here, and then if we're doing this. Let's give out 5 YouTube memberships. Sneak that up on you guys. Danny, Charlena, Tina, Teresa, and Juanita all got YouTube memberships. I hope that is super helpful. We'll give away some more YouTube memberships tomorrow night when we go live. I hope those bonus videos are helpful. Why are we all the way over? There we go. What a nightmare. Here we go. putting together a bunch of videos for like a complete course of medical coding certification videos. So they're on the YouTube channel. Just look at the playlist and it'll just say medical coding course, and you can start with those and then work your way through the workshops and duck classes. Those are super handy dandy, and the book prep videos. Those are fun. What did you guys think is the answer for this one? Anybody? We got 22 with Taylor. Mabel says 21. TikTok, I've got Mr. Lovett B also. 21 is correct. And if you don't know this, you can add on your page of place of services, you can add this verbiage right there next to that 21. That way you won't miss it next time. Pharyngeal Doppler cardiac monitoring would definitely be in our admit, and it'll tell you where the answer is, page 19 in your 2024. It's also, if you happen to have a 2024 hip picks from AAPC, it's on page 600 and also on page 763 in your hip picks book. That's why we like Pocket Prep. I love having the page numbers down. Even my practice exam questions on my site don't say that. If a patient is suspected of having been infected with HIV and the physician wants to perform a diagnostic test, which of the following findings is not covered? Patient has a documented AIDS defining or AIDS associated neoplasm. The patient states that she has been exposed to HIV infected blood and is not on any therapy at this time. The patient has signs and symptoms of an acute viral syndrome fever, lymphadenema and rash, or the patient has documented AIDS associated neurological disorder and unexplained dementia. Which one is not covered? Fagan, A, B. It's the one where they've been exposed and is not on any meds. Just because they've been exposed doesn't mean that they have it. Our answer will be in the ICD-10 book. If you happen to have the AAPC version on page 457, or in your HipPix book on page 665. Patient comes to the office with Medicare card and a Blue Cross Blue Shield card, stating they have Medicare Advantage. What is the coordination of benefits with this patient? The Blue Cross Blue Shield is primary, Medicare is secondary. The Medicare card is only used. Medicare is primary, then Blue Cross Blue Shield is secondary. Blue Cross Blue Shield is the patient's coverage, and the Medicare card is not used. What do you guys think about on this one? Thank y'all for all the likes, taps, follows, all that good stuff. I hope y'all have a good holiday tomorrow. I hope y'all don't have to go to work. Hope everybody can stay home and still get paid to be home tomorrow. We got 15 viewers on and 7 likes on the YouTube channel. And we got almost 2,000 taps and a couple of shares on TikTok. Thank you guys. I hope to see you guys tomorrow. We'll have more of a formal session tomorrow. I'll prep some questions for you guys. We got B's, C's, and D's. D is correct. You're supposed to go to Medicare.gov to look up that answer. As of January 17th, how is urine drug presumptive test reported? Do we use a HIPIC, CPT? That's the first thing. These are some of my favorite codes in lab and path area. Paper bowl. No, I cannot. Lord of the Rings is not boring. What do you guys think? Everybody giving up? We are using that range of codes, the ones that you cannot times. Yep. Those are on page 585 and 616. You can also find the answer in your HIPICS book if you have AAPC's version on 620 and 622. If you love these kind of questions, they're great. Just go to the Pocket Prep link. You can get there through my website, of course, by just clicking here on my website. As soon as it pops up, there's your pop-up, the little pink one, and that'll take you straight to Pocket Prep. Just click medicine, and then the very top link is our AAPC CPC exam prep. You can get access to 750 practice exam questions for like $15, and they do have a pass guarantee. So super cool. We love our Pocket Prep. I've been using them, I don't know, since 2020. How many days in a global period would be considered a minor surgery procedure? What do you guys think? "10 days is a minor surgery." Good job. And our answer is on page 76 of the 2024 CPT book. What is a physician fee schedule? Is it the amount the physician charges, or the amount the procedure is allowed, or many units the coder, or insurance company? What would we be looking for in an answer? Very good. A is correct. Good job. That's in your HipPix book if you have AAPC's version on 747. Which of the following services is a component requirement for CR/ICR services? Psychological pneumonia, heart-lung, or current stable angina? Shh. Are you eating that in my living room? James Michael, you're not even fucking trying to tell me. You're not telling me. No. Milk stays in the kitchen. Good job. Psychological assessment, we're on page 852 and 865 of our CPT book. What is a HIPAA privacy rule? Ooh, I just released a video with that today. It has practice exam questions at the end, super easy ones. But I was just trying out, I'm trying out different styles of how to do the course on the video feed of a complete course of videos, and this one that I just released today on HIPAA actually has practice exam questions at the end. So I don't know, playing around with the different styles and seeing what's most liked. Yes, we know it's a standard. Is it a standard that establishes, or is it a standard for when and how, or for secure and safe spaces? If it's a standard, is it for personal health or safeguards? Patients' access to that information? It's created and maintained. Standards for when and how patients notify about breaches in their information. Standard to establish and require patient safeguards and patient access to that information. Standards for securing a safe place to treat patients. C is correct. And we just find that at the U.S. Department of Human Health Services website, or you can just go watch my video on that I did today. What does the asterisk mean? Covered only if, whoops, sorry, didn't mean to click it, but that's true. That's what it means. That is in your HipPix book on page 651. Which of the following is a reason why patients will usually receive dialysis treatment in an inpatient setting? Is it because they have borderline kidney failure and have developed acute kidney? Or a patient was admitted with another illness? A patient has chronic, or dialysis cannot be billed as an inpatient setting? only going to get inpatient dialysis if they're admitted, right? Kind of a trick question, but we've got acute borderline kidney failure, has developed an acute kidney failure every time he gets sick. That's on page 762 and 626. Now, if they've been admitted with another illness like cardiovascular issues, we've done their renal treatment in the hospital when it's due. Which of the following abbreviations is newer part of HIPAA, dealing with mainly the electronic record of transmission? This also is in that video that I made today and put out there. I kept trying to call this PHI today, OIG, high tech. Yeah, high tech. Easy peasy. That is at our U.S. Department of Health and Human Services website. Which of the following is not considered PHI, a driver's license, an op note, a voice recording, or a photo named as survivor on the bulletin board? Huh. Driver's license. Yep, your driver's license. Which reference describes the requirement to code based on medical record documentation? Is it CPT, evaluation management, or the CPT instructions, HIPICS, ICD-10? Which reference describes the requirements to code based on the medical record documentation? We've got two answers that say CPT, sorry. ICD-10 or HIPICS. If it is the CPT, is it the instructions for using the manual or in the E&M guidelines? A and B. ICD-10, Chapter 1. In the very beginning of your CPT book, if I know I've told y'all before, if you have not read the instructions for the use of the CPT book, it's a good read. These pages all the way to the special services is a really good read. It tells you all about, of course, the parent code and child code, but it also has the instructions for medical record documentation too. Pretty cool. Which of the following cancers is covered with exception for an initial treatment strategy for an FDG PET scan? So if you have esophagus cancer, is that an automatic exception that initial treatment of this cancer is automatically going to get you a PET scan? Soft tissue carcinoma, breast female, or brain? You think you've had this question before? Awesome. On a certification exam or in pocket prep? In pocket prep? Yeah. Answer is found in the HitPix book. Is it breast cancer? It's one of our most common cancers, is breast cancer. According to Part B, which of the following groups of people are not considered high-risk individuals for hepatitis B? Renal patients, patients in a SNF, patients diagnosed with diabetes, or the mentally ill? Not considered high risk. I don't see a higher risk of hepatitis B in diabetes patients, I don't think. Now, patients in a mental hospital, don't know. I got B or D. Anytime you're residing with a bunch of other people, you could catch other things. If you're on dialysis, you're constantly getting injections and infusions and people messing with your lines and stuff. It's patients regarding in a SNF. Awesome. Those patients are patients currently reside unless they share a room or are not considered immediate risk. But they share rooms in SNFs, so that just seems really crazy. Crazy kind of question. According to Medicare, if a patient does not have this testing included with a warfarin treatment, there are consequences that greatly affect the patient's health. Which of the following is not a consequence? Kidney failure, major hemorrhages, thrombus, and death. So if they're not getting their Coumadin levels checked when they have a reason to have it done, which of the following is not a consequence of not checking your Coumadin levels? Yeah, me too, Taylor. I don't know where they get those. And senior citizens, like in nursing homes and stuff, they pass so much stuff to each other. It is crazy. You know, the little village in Florida, you know, has the highest sexual transmitted disease per capita. You know, the little old ladies and little old men, you know. They're having fun out there in the sunny state of Florida on their little golf carts. I can't imagine them not spreading that hepatitis B. And then when they all live in the same area, I don't know where they're getting their facts from, but okay. A lot of times it's not what is a correct answer. It's the answer that the company giving you the test wants you to know and they want as the correct answer. So a lot of times I have to learn what AAPC wants as the correct answer. And what they wanted as a correct answer is what they have printed inside their HitPix book. So that answer would have been probably in their HitPix book. This one's probably kidney failure. I don't know. Or death. Kidney failure. If you're on Coumadin, page 643, you're not going to die from kidney disease, but you'll die if you don't keep up with your Coumadin levels. Take too much medication. According to the publication 100, which service would not be covered as Part A for medical hospital insurance? Is it hospice? The first 3 pints of blood. Really? Post-hospital care performed by a home health agency. Post-hospital care performed by a skilled nursing facility. Don't give me blood products because they're not going to cover it. You're bleeding out. You need 3 pints. No, I got to pay for it. It's too expensive. Page 625. According to HIPAA, which of the following is considered a violation and should never be done at a doctor's office? Calling a patient by their full name in the waiting room, responding to a court order, printing an op note but disposing of it in a shredder afterwards, discussing a specific patient care with other healthcare team members. Responding to a court order of medical records without getting authorization from a patient. If we have a court order, do we need to let the patient know that we're sending their records over? Nope. If you have been court ordered, you've got to follow your court order. Calling the patient's full name from a waiting room into the clinical area. You can't go John Michael Reagan Brewer or, Travis James Michael Brewer or James Michael Reagan Brewer out there. Oh, goodness. Too funny. Now, what you can't say is, Travis, come back, for your condition. You can't say, you're here for, your diabetes, all right? No, you can't holler that out in the waiting room, but you can say, Travis, come on back. It's too funny. When you're here on this table, don't forget that you can go over to the review tab at any time and you can see all of the questions and answers by just clicking, and then it will bring up the question and then the rationale all on one page for each question, and you can scoochie down and go through all of them and see all of them if you ever wanted to, kind of on one screen. It's kind of neat little area that they have if you ever wanted to do that. And once you answer all 750, they'll all show up here. I still got some new ones that I need to do. Of course, you can see your stats and stuff like that. See, I've had them since 2022. Oops, sorry. I don't know what happened. I didn't click anything. Ugh. I hate when this thing comes up. But anyway, hope that was helpful. See, now I've got all the practice questions up again. It's kind of cool. You can click on it. I don't know why it's looking so weird. I don't know why it does that. It's so weird, but yeah. Back to the review. There we go. Back to the stats. And back to build your quiz. Like our old pocket prep. Does good. I will be back on tomorrow night. We'll do 4:30 Arizona time zone. I have a bunch of practice questions that we're going to work on. Some more CPT flashcard stuff and finish up some cases. I've got a couple of cases I wanted to do and more E&M. Who do I have for tutoring this week? I can't tell because TikTok's on my phone, but I think I've got somebody Tuesday and Thursday for tutoring this week. So I hope I got to get that stuff prepped also. But the kids will be home all day tomorrow. They'll go back to school on Tuesday. And we do not have any football games this week. He has a football game coming up on the 11th, so we're okay till then. Now this weekend they're doing a cheer camp, and James is going to make beds for children in town. He's part of some builders club or something, and Saturday they're going to go and build a bunch of beds, because we're trying to make sure that every kid in the county or whatever has a bed to sleep in at night. So that's kind of cool. I remember one time when I was a young mom, my oldest didn't have his own bed, so it was a cat or dog bed is what he actually had. So, you know, I've been there, done that. We've all had to struggle, so that's kind of neat. I like to see him helping out next Saturday doing that. But I'll be around. We'll do free live lessons Monday, Wednesday, and Friday. And we'll do 2 hours each time. And I hope to see you there. I hope this was helpful. And we'll give away some more YouTube memberships there too. I'll see you guys tomorrow night. Good night, guys. I've had this one on Pocket Prep too. Yep, it's Pocket Prep, Samantha. It's Pocket Prep. I was showing off some Pocket Prep questions. I'll see you tomorrow night. We'll do some more. We weren't doing anything important. We were just making some corrections to the 2024 CPT book that we got from the AMA. Then we went into Pocket Prep and did a few questions. But we'll be back tomorrow night. We'll see you tomorrow. Good night. So proud of you guys.